High drama in Washington, but somewhere along the line we got to talk some policy.
The Dan Yorke State of Mind program is brought to you in part by Lookout Rhode Island and Takeo Comfort Solutions.
You know, all the economics coming out of Congress right now really mean a lot to us here at home, and never more so than what we're talking about in terms of the current tax cuts, how they're now bleeding back into health care with some backdoor Obamacare changes, including the mandate, which really sends the whole thing on the spiral because it's kind of the middle of the entire Obama mix. And then there's this conversation about the benefits and entitlements, and you could use either term you want, but there's a whole bunch of stuff that we kind of count on here in southern New England and specifically in Rhode Island that might be in jeopardy. So we're going to talk about that tonight. How are you? Monday night, Patriots with another snoozing win, but my Giants got one. Never seen more celebration out of a second win this deep into the season ever, but you know, you take them when you can, right? Here's some of the buzz in Washington late last week regarding tax cuts and implications.
This tax bill is now officially a health care bill.
How many will get the double hit of a tax increase and coverage loss?
I don't know. I haven't figured it out, but all this conversation is trickling down to specific challenges, and here in Rhode Island, those who serve the elderly really are worried about it. Charles Fogarty is our former lieutenant governor, of course, and he runs Elderly Affairs. And don't go snoozing at bed. This is not, I mean, you're all going to get there, by the way, if you're not there already, right?
Absolutely.
Except you and me, Charlie. We're not going to get there.
I'm heading there, Dan.
My goodness. Welcome. Good to see you.
Pleasure to be here.
This is a very strange time in Washington. Look, we're always going to have partisan philosophy for financing and entitlements and benefits, and all the things that we kind of expect from social services nationally and locally are always subject to debate. Roy Moore and Al Franken and all that drama down there and the way Donald Trump kind of comports himself actually have had an impact, though, on the stuff we expect to be decided down there. Before we get into the specifics of what Elderly Affairs is concerned about, and by the way, Medicare open enrollment is ongoing with a short deadline, and we have some advice for you tonight on how to get engaged in that. But what's your broad 36,000-foot scope on this whole thing?
Concerned about the fact that policy decisions that are going to affect people's lives haven't put people first. There's these overall objectives that people want, and they're going to get there no matter what it takes. That behind every number, whether it's a tax cut or tax increase or somebody getting off health care, there's a family that has real issues and problems and challenges that's going to be affected. And I don't believe that what's happening in Washington is giving appropriate concern for that fact. It's being rushed through, and we will find out, unfortunately, if it does pass, that there are many, many people here in Rhode Island and around the country who are going to be hurt by it.
Well, you know, it's interesting. You have you've been a government guy most of your career, right? So,
yes.
When you're not being sportsmanlike, one would call things you do hackdom. When you're being sportsmanlike, you call it bureaucratic.
Dedicated public servant.
And then when you're really, really being nice, it's dedicated public servant. And the more I learn, the more I've been around, the more I understand it's more the latter than the former. You're able to see these kind of difficult conversations for everyday people to digest. The ambiguousness, not the ambivalence, but the ambiguousness of these conversations actually manifests itself on the ground. I mean, that's the kind of place that you are in. The ground a little shaky right now when it comes to the elderly. You've lost a lot of money in your own department over the last decade or so, right?
Exactly. Back in 2006, our budget was about $47 million, mostly federal. It's 70% federal, 30% state. Now it's just under $20 million. And yet the elderly population in Rhode Island has increased significantly. So we're concerned not just about the proposed tax cuts as it might affect Medicare payments to the 200,000 Rhode Islanders who get Medicare, but also some of the other programs that we serve. The SHIP program we'll be talking about today that provides counseling to folks, senior companion program. Others, they're all on the chopping block for the proposed budget this year that still has to be enacted by Congress sometime in December. So we're concerned about that because if 70% of our funding is reduced further, we're going to have to make cuts and elimination of programs that people have come to depend on.
There's a constituency for every program and a program for every constituency, but we had an interesting exercise on the radio the other day. After you left, you were on having the same discussion, and I actually just kind of had a little, I don't know if you were listening on the way home, but I had this little kind of, I don't know, neurotic discussion with myself on the air as to whether or not talking about Medicare has any marketability, and whether these kind of conversations, sell to the general public. And Lexi, Kristen, my producer, she was saying, well, I think it's important that young people understand this because your parents are headed in this direction. I was like, really? Sure enough, phone started to ring where people are going, hey, listen, not only am I concerned about it, I don't know anything about it. And I guess and we'll talk to our next guest, one of your fine volunteer staffers, about this coming up. A lot of people heading toward Medicare age don't know anything about it either.
Exactly. Not just the folks that are in Medicare, those heading toward Medicare age, but as you point out, even family members. They want to make sure that mom or dad are taken care of. And they want to know what the options are and make sure they make the correct choices, because they obviously care about their health, their future. And from a selfish perspective, I guess they want to make sure that an unnecessary burden doesn't necessarily fall on them as well. The
actual tax cut proposals, and listen, the budget's got to be affected by the tax cuts, and reportedly there's $1.5 trillion that are going to come out of the hopper, only to be replenished by what we used to call in the old days trickle-down economics, right? That the economy will do so well and blow up so well that the revenues will come back to the government. Based on it. Medicare itself and Medicaid itself, if I understand it, are not cut. They're just no growth. And no growth means a cut?
Yes, it does. But at the same time, when there are tax cuts that you have to accommodate revenue for and you don't have it, there's the pay-go process, meaning that other programs have to be reduced. So we're looking at a potential reduction of $25 billion in Medicare, which in the scope, nationally, yes, not just in Rhode Island. So, that will inevitably have an impact about choices, options, coverage, and so forth, not just in the future, but over the next year or so as well. So these are things we have to look at, that everybody's focused, or the proponents are focused on how wonderful things will be if we do this tax cut, which people aren't quite sure if that is necessarily the case, but there will be ramifications if it goes through on the other side in terms of cuts to programs that people might not think are connected to the tax cut.
All right, so if I understand it correctly, Medicare itself likely will be level funded, but for lack of a better term, staffing around Medicare funding is in real jeopardy. And this SHIP program that you talk about, which is an acronym for
Senior Health Information Program.
It's the helpline.
It is.
It's a help office. Yeah. It's hand-to-hand. Okay, Mrs. Jones, congratulations on your 65th birthday. Now we're going to try to figure out how to keep you medically insured. And you can come into the state.
In a renewal period, it's coming in and saying, okay, here's what I had last year. Things have changed with my drugs or the formulary. How can I make sure I'm getting the best deal possible so I don't get surprised?
How many citizens are you actually serving in that program?
In a year, last year we served almost 22,000. This year we'll serve more.
And our elderly population is in the couple of 100,000 range, right?
The number of people on Medicare right now are about a little over 200,000. Some of those are younger people with debilitating diseases, end-stage renal disease and so forth, but about 166,000 of them are senior citizens, people over 65.
All right, so you're worried about this particular program being slashed to next to nothing, correct?
Exactly, because it has a phenomenal impact. I was in Pawtucket on Friday. We're going out visiting the sites and met with Joan Newton, one of our top counselors out at the Leon Matthews Center in Pawtucket. She had just finished counseling a woman whose son had brought her in. He said, Mom, I want you to come in. She goes, I'm happy with what I've got. She was already on Medicare. And she had a prescription for some medication for her leg. And what happened between last year and this year is the program that she had selected, the formulary, didn't cover that anymore. So it was going to be $900 a month. They were able to identify another plan for her, which she only has a $47 a month copay for. Now, had she not come in there, she wouldn't have known that, and she would have gotten a real big surprise, and in all likelihood, she wouldn't have been able to afford to have that medication. So we have story after story of folks who are getting savings and getting health care that meets their needs. I think I mentioned to you on the radio show, we're part of a pilot. We signed up to do the pilot program to see the actual saving results from SHIP. It started this past spring, so we have June and July numbers. On average, it's about $1,000 savings for people who come in and use the SHIP counselors than they would have done otherwise had they not done that. And for someone on a fixed income, that's not chump change anymore.
I want to learn how this SHIP program works and what your options are to get enrolled for Medicare, and we come back. Stay with us.
There won't be any Medicare if we keep spending like you guys want to do.
Well, you know, that's always the issue, right? Medicare, Medicaid, Social Security, the big entitlements. Republicans like Orrin Hatch. We'll talk about the other spending that Democrats want to put pressure on that program. The Democrats are saying you're leaving the most needy in this country away as you try to accomplish some kind of tax cut, task by the end of the year, because so far you guys have the bubble when it comes to accomplishment. So that's the debate that goes on back and forth. In the middle, you're trying to figure out how you're going to keep services
trying to put
going.
people first at the center of it.
Who Janet's going to actually be helping volunteering. Janet Galluccio is with. Nice to meet you. Nice to meet you. Having one of those days. You're a volunteer.
Correct.
With the SHIP program.
Correct.
Which is Senior Health Information Program. Again, when we start to get into these acronyms, we talk about Medicare and Medicaid, people go, but the truth is that you see a lot of real life on the ground, right?
Absolutely.
You've been doing this for a decade?
10 years, yes.
What have you learned in 10 years about your volunteer work?
It's amazing. It's just, it's heartwarming to help people and to help them navigate the system. It is a very complex system, and when you can help someone, save them a little money along the way. And most people are very appreciative. They come back year after year.
So you're counseling on how to get into the Medicare program and how to stay ahead of the curve, right?
Yes.
With everybody?
Sure.
Do you see people annually? Or like once they're in, and good luck to you?
It's variable. We have people turning 65 every day of the year that need assistance. We have people that qualify for Medicare through disability every day of the year. We have life-changing events. Somebody moves into the state. They need health coverage. There are billing problems along the way. There are many different aspects.
Glad Janet mentioned that. Nothing specific to the SHIP program and Medicare execution has anything to do with the UHIP controversy that we have with the big bad computer in the sky that's having a lot of trouble with
Medicaid,
other
not
health benefits.
Medicare. Yeah.
Medicaid,
Yes.
not Medicare. All right. So and to distinguish between, for those of you who don't really know the difference between Medicaid, Medicaid is for the disabled and low income.
Low income people, and it's a state federal match.
Gotcha. And Medicare is all of us. That's the, once you, congratulations, make it 65, someone's got to keep your health insured.
Universal health care.
That kind of program. Well, you use that term, universal health care, and there's a whole big debate in America about whether or not we need that or want that. Truth is, by the time we get to 65, we've got that. But we don't have it for the 35-year-old, but we have it for the 65-year-old, which I don't think is really a concept a lot of people get until all of a sudden they're into it.
They think it's something totally different, yep.
Will Janet's work be subject to the cuts that you're worried? We're going to talk about what you do and some advice for some people very shortly, but is Janet's work short-lived right now? Are you worried about that?
Well, Janet is with us through December 7th, and that's when open enrollment is. This is our busiest time when people who are already on Medicare come in to have to make choices and decisions about what they're going to do in 2018. Right now we have funding nationally, Rhode Island and all the states, to continue the program through April 1st. We're hoping that in the upcoming budget process, which is ongoing in Washington, that it will be funded again. The Trump administration basically proposed to eliminate 94% of the coverage of funding for this program. The Senate has taken it up and is proposing to provide a little bit of a cut, but mainly keeping it going. So we're trying to point out the value of this. This is not just something nice to have. This is a difference in people's lives about getting coverage that meets their needs at a price they can afford.
All right, so later in the discussion we'll talk about what Rhode Island might do to step up to fill the gap if we get hit this way. So you're kind of like that person who during tax season helps people with their taxes.
Yes.
This is open enrollment season, helping with your health insurance if
Correct.
you're 65 or older.
Yep.
All right, top tips right now in terms of what people ought to be thinking about.
You need, at this time period up until December 7th, it's review your drug plan, review your Medicare Advantage plan, see if it's all going to work for you. You can call DEA, you can call the SHIP number and make an appointment. Somebody will either talk with you on the phone or hopefully a one-on-one session could review all this, and if changes need to be made, they need to be made now.
How many people do you see a season? As one of the, you see hundreds of volunteers?
We have 30, this year we have 35 volunteers and 53 staff because we fund other
right.
agencies, senior centers, case
right.
management agencies, United Way, for part-time for those positions. So we'll see literally thousands of people over the course of
Before we get
period
into
of
more
time.
details, you have some graphics you want me to show here. Tell me what we're looking at here, Kev. Just put them up one by one. This is, I don't expect either one of you to be able to read that on my small monitor. I'm hoping that those of you with large screens at home will have one. This is what? This is the number of
folks. I think the bottom one is the number of folks who are age 85 and older, and we rank on a per capita basis #1. So ironically, our fastest growing segment of the population per capita is now 85 and older, and certainly when that happens, you tend to use more health care than not.
It's good news.
It is for all of us heading up there.
Sort of.
Yes.
Right? You got to be able to afford it. Division of Elderly Affairs chart here. What is this?
And those are the demographic trends over the next 25 years. Right now, we have about 170,000 seniors 65 plus, and we'll be going up to about 250, 260 in the next 25 years. So that's a 60% increase. So the percentage of people in Rhode Island who will be 65 and older in the year 2040, which is not that far away, is going to be significantly up from what it is now, which has all sorts of consequences for programs and services.
What's the biggest mistake, misunderstanding, etc., do you find people run into?
The misinformation or confusion in signing up for Medicare, signing up for Part D, because if you don't do it when you are first eligible, there's a penalty that you will have the rest of your life.
How big?
It could be substantial.
Meaning?
For every year that you do not sign up for a Part D, 5 years from now when you decide to sign up, you're going to pay a 1% on an annual, it could be several dollars a month.
D is drugs, right?
Correct.
All right, you know what, we're going to break here. We'll come back. There's all sorts of parts to Medicare. We'll talk about what those are, and then we'll talk to Charlie about whether or not this is the kind of thing Rhode Island will save if it has to. Stay with us. Now look, you have to December 7th to enroll in Medicare and or change your plan, correct?
Not to enroll in Medicare, to look at your drug plan and your Medicare Advantage plan and your health care options until December 7th, which becomes effective January 1st.
If you turn 65 next April, what happens?
That's different.
Well, tell me what happens.
Okay. If you turn 65 and you are going to have to initiate your enrollment into Medicare, and you do that through Social Security office, not through Medicare. Medicare manages Medicare, but you enroll through Social Security. If you're 62 and you're collecting Social Security, when you turn 65, you will automatically get your red, white, and blue card in the mail, and it's up to you if you want to accept A and B. A is free, that's hospital insurance, because you've worked for 10 years or 40 quarters, so it's free to you. B is $134 a month, and that is up to you if you want it or not.
B does what? That's the general.
B is doctor, lab
visits,
work.
all that stuff.
Yes, yeah.
Who doesn't take A and B?
If you're currently working and you have group health insurance,
right,
then you don't need to have Part B. A is free, so you might as well take it. But B, why spend $134? You don't need it if you've got group health coverage through your employer. Right.
Now, certain pre-existing conditions or health issues can affect the premium on B, correct?
No.
No, B is always $134?
Correct.
What's C?
C is Medicare Advantage plan. Those are your health coverage and drugs combined into one plan. They're typically HMOs, PPOs, and we have 2 companies in Rhode Island that offer various plans.
All right, and you help people shop through those plans?
Correct.
Do people generally go see to do a hybrid when they are exclusively on Medicare? If you're on A and B,
Yep.
you're not in C.
Correct. Well,
If you're in C, it combines the concepts of A and B.
you have to have A and B in order to go into C. So you still have to pay your Medicare, your Part B premium of $134.
Yeah.
And then you enroll in a Medicare Advantage plan. Many of those plans are 0 premium. There are some that have a cost. But what happens is your Medicare Advantage plan is your primary payer. You can't pull out your Medicare card and use it again because it's been contracted that Dan Yorke Insurance is going to cover me. You're my payment. Medicare's not.
And D has its own fee, or is D free?
D is another one you shop for, and there are 35 plans. 35
For
drug
prescription.
plans. Correct. And you purchase those. Some of those are $12 and they go up to $122 a month.
And this is the important one because obviously as you get older you tend to have medications and the formularies from each plan change from year to year. So the plan you have right now might be fine for you in 2018, but it may be changed in 2019 and some of the drugs that you use might not be covered and there may be a higher cost. So it's really important that people look at it every single year.
Who other than Janet and the other volunteers helps people with this concept? You got to get a book, Medicare for Dummies. I mean,
This is your Bible.
You know, what is that? That is your pamphlet.
Medicare and You is when you are on Medicare, you receive this.
So let's just make sure we understand. If you're going to change your plan for 2018, you need to do that by December 7th.
Correct.
It's got to be done. And if you don't, you're still on what you have.
Correct.
Got it. And if you're on Social Security, but you're working for a living still, you're enrolled in A.
Yep.
But you've got to act if you think 2018 is going to change.
Right.
What if you lose your job in 2018?
That's right. Then you have a period of time to
jump
enroll.
on.
Yes, yes.
Okay, but this is the enrollment time to change the plan.
This is time to change it. And again, there are some insurance companies that are doing things. The difference between us and the others that are doing information sessions is that we have objective, unbiased advice. We're not selling any product or service.
Right.
We're just saying, here's what it is, here's what we think makes most sense for you.
All right, put that number again, Kev, will you, one more time. This is the number. You might end up meeting Janet, you may not, but you'll be lucky if you do. 888-994-9721. I only have 20 seconds here, Charlie. Will Rhode Island step up if this program gets slashed to death?
Well, we're going to look at preserving as much as we can because I believe it is a tremendously valuable program for our seniors. It saves them a lot of money, and we're going to look at what we can do with the resources we have.
Yeah, I mean, listen, the bureaucracy is tough enough. You know, you seem like you really know your stuff. Can you hang around for about 9 years? And I'll see you. Okay. I'll see you in 9 years. All right?
Happy Thanksgiving
God
to you.
willing, happy Thanksgiving to everybody.
To
Final word, and we come back. Stay with us. That December 7th deadline is an important one. We'll make sure that on foxprovidence.com we have that information for you and that phone number too. You want to pop it up one more time, Kev? Can we do that in a 5-second period of time? I just threw that curveball at him. There we go. 888-994-9721. Really, it's a great chance for you to get oriented on all of the decisions that you have to make by December 7th for Medicare. We'll see you tomorrow night and on the radio at 3 on WPRO. It's a holiday week. Enjoy.